So we are here today with Amir for his first MaxHarvest Plus hair transplant procedure. You've never had a hair transplant before,
No.
correct?
No.
Okay. So, what made you decide to have a hair transplant today?
I decided because I feel less confident. So I feel like it's time. I look older. I'm 33, so I thought to get it done.
So, did your hair loss keep you from doing sports or going out with your confidence?
Social, more like social situations. Yeah.
Okay. And does anyone in your family have hair loss?
Everyone is my family boss.
Okay.
I'm the lucky one.
So, we're gonna fix you. All right. So when we do the MaxHarvest Plus hair transplant procedure, we're trying to maximize that donor area instead of just doing a regular 30 centimeter strip. Where if the patient has more length, we try to get it. If there's more elasticity available, we go for it. So it's a little bit more of a challenging recovery due to the extra tissue that's taken out. So you're going to be a good patient, take great care of everything?
Yes, absolutely.
Okay, excellent. Did you have any questions about anything before we get started?
I'm just nervous. So.
All right. Well, everybody comes in here nervous.
Yes.
Everybody walks out of my office saying the same thing.
Yeah.
That's it. I mean, you watch the videos. Have you watched any of my videos?
I watch every single one of them.
All right.
That's why I know everything.
All right, perfect. All right, so we're going to draw your hairline out here, my friend. Now, I want you to show me with your finger where you would like that hairline if you were to get to just start drawing your hairline today.
Well, the first time you did, whatever you did, I'm okay with that.
Okay, so just put it
Just
back.
do your magic.
Just do my thing. All right, so basically what we're going to do today is just kind of follow the same exact plan that we did before. So I'm going to draw everything out for you, and we'll talk, and then we'll kind of go over everything. I promise you're going to do everything right, right? Okay. Wow. You know what? I hate to say it, but I just impressed myself again. I love it. Look, it's on the money, man. That's what we call a perfect shot. Look at that. So watch. What do you think?
Sounds good.
You love it? Make sure, man. This is important. Okay.
Whatever you do, your eyes think you're the tailor.
So what happens is that as we lose our hair, we go back this way,
Mm-hmm.
but we also go back this way.
Right.
So I have to make sure that this looks natural from the profile, and that way this blends in naturally. So I always get it as low as I possibly can get it, without it looking unusual from any of the angles as far as profile or something like that.
Right.
So this is about on the edges to where I can get you without it looking unnatural from the side.
Yeah, I want it to look
And
natural.
that's the key, is to make sure it looks natural. Now I never make the two sides look the same. The reason for that is, Amir, is none of us are symmetric. If we take anybody's body and cut it in half, one side doesn't match the other, and that means I never make the two sides look the same.
Okay.
Okay? So I always have one side higher, one side lower on purpose, so that way it doesn't appear eye-catching to someone who's looking at you. Okay? So after the procedure, no going to the gym, no heavy lifting, rest, rest, rest. Follow your instructions. And have you sleep upright for a few nights without coming into contact with the grafted area. And just be a great patient and take great care of everything. Do you have any questions as I'm trying this out for you?
No, just how long I shouldn't go to the gym or.
No going to the gym for 2 weeks after the procedure. That means just take it easy, let it heal. Once the stitches are out, which will be for you minimum 12 days from today, I'll tell you exactly when we're done. Then you can start slowly going back to the gym after you get your stitches out, which for sure I want you to give me 2 weeks on that. Okay, so stitches, 2 weeks. Scabs and crusts will be gone within about 10 to 14 days. The small ones go away after about a week or so. The bigger ones can take upwards to about 10 to 14 days. Alright, so what I do here is I create the frontal hairline by making tiny little one hair grafts from the top line to the back line in a staggered appearance, so it goes front, back, front, back, front, back, so it doesn't look straight the whole way across the entire hairline. It's all composed of tiny little one hair grafts. You blend it into the existing hairs over here on the side, so it blends into your hairs on the side. I do the same thing over here on this side. Okay. Then what I do is after I build the hairline with the 1 hair grafts, I put the 2-3 hair grafts behind that, and then I will use those stronger grafts in between to help create the density.
Right.
Now, this is my priority number 1 is getting that front situated. That's what's going to change your look. It's going to reframe the face and make everything look different to you as far as your first appearance with yourself and as far as meeting others. So priority 1 is there. Priority 2 would be going for this bullseye. Okay. Everyone looks at this and thinks, "Oh wow, that's a small little area. Just fill this." You can't do that.
It's a big area.
It's because if I just fill this and you lose the existing hair around that area, it creates an island of a hair, which looks unnatural. So what we have to do is always blend into the existing hairs the entire way around to make sure nothing is unnatural between my grafted hair and your natural hair, so that doesn't come out unnatural when you lose more of your natural hair. So I create what's called a spiral. The spiral, I know you watch my videos, creates the direction angles of the hairs all the way around the entire crown. That feeds the directions and angles of hair so it covers it, right?
Right.
So priority 1, this. Priority 2 is this. Okay. And what I'm going to do now is I'm going to trim the area where I get the donor from. Okay. So you'll be able to.
Are you gonna shave this part?
I would love to.
Yeah. So.
Oh, please, thank you. So, Amir listened to my videos and he heard what a great idea it was to shave, and I couldn't be happier. It makes my job so much easier. But more importantly, it's also easier for the patient. The patient's able to take care of it much easier without the hairs in the way. So when they're washing it, it doesn't have the potential of dislodging a graft. It just makes it a much cleaner environment for healing, and it makes it overall a better process. Patients are able to wear a hat as soon as the next day, as long as it's granular clean. Alright, so let me show you what we're doing here, my friend. Okay, so what I do is I trim the area the entire way around. So I go from the one side all the way around like this, all the way around like this. So I take you from one side to the other side, finger the skin coming out, pinch it together. Just take it out, pinch it together. Everything in this area, hopefully, will be on the top of your head. Now when you look at that, now you see what I'm up against. So that's why I don't want to get too crazy on you. Unless, you know, that's a priority. If that's a priority, then we can shift what we would put in the center there.
This is the priority.
Oh, that's how I would guide you as well. Okay? Do you have any questions about that at all?
No questions.
All right. You are easy. Okay, so we just got through harvesting our patient Amir's donor hair. We were able to extract 3 separate half-centimeter strips. Let's take a look at what we did here. The whole process took us about 20 minutes or less. As you can see here, our first strip is about 36 centimeters. If you look up top here, this is a 35 centimeter ruler. On the bottom we have a standard ruler, which is a foot, equivalent to about 30 centimeters or so. So our very first strip, you'll see, is over that 35, 36 centimeters. I want you, the audience, to take a look at how there's no transection. For anyone who watches my videos, transections when we're dissecting the follicle in half and destroying it. So as you can see, everything's intact from the top to the bottom. You can see bulb, follicle, bulb, follicle, bulb, follicle, meaning it's coming out on the top and it's not cut down the middle. Now, what's interesting about this is you'll see on this top strip, it's 36 centimeters long, but it's a half centimeter in length, which means this is equivalent to 18 square centimeters. This one strip is equivalent to 18 square centimeters. If you were to have a ARTIS procedure by the robot or a follicular unit extraction procedure, their best day may give you this one strip. So this one strip is what you can expect in total for your entire day of harvesting all the follicles out one by one. Now, if you look here, we have an additional 2 separate strips that are even longer than that first one, also without transection, yielding the full amount of donor hair. As you can see, everything's perfectly intact, where there is no cut follicles. If you look at that, just pristine as could be. Okay? So we'll be able to maximize the donor out of that area. So we were able to get this patient another 2 strips in the same or bigger length than what you'd get by doing the robot or a follicular extraction in a fraction of the time. So this patient's going to yield anywhere between, let's say he has, each of these are half centimeter strips with a total of 56 centimeters squared. If the average patient gets 200 hairs per square centimeter, he's almost at about 12,000 hairs right there. So a little less. Let's call it 11,000 hairs for math. So 11,000 hairs in one procedure in approximately 5 hours. We just got through harvesting your donor as you saw. You saw your strips. How long did this whole process take?
Maybe 30 minutes.
30 minutes, okay. And did you see how much hair we got for you?
Yes, 3
Okay,
strips.
3 strips. The equivalent of 56 square centimeters. About over 11,000 hairs. Okay? Alright, now, want to see your suture line?
Not really.
I appreciate your honesty. Okay, right?
Even though I know you have magical hands, but
So that's your suture line. What do you think of that?
I don't know what to think.
Isn't that cool? Look at that. You can't even see it. Remember that big area?
Yes.
So that's going to heal perfectly. You're going to do that. So if you would have went for a follicular extraction, they would have spent all day getting a third of the hair that we got for you.
Absolutely.
Okay? So it went absolutely perfect. How you feeling?
I feel great.
Okay, how did you do for pain? Did you have pain during the process?
No pain.
So no pain, and it was smooth as could be.
Absolutely.
Awesome. All right. Now we're going to put it in. All right, we just finished up surgery with Amir. The whole process took about 4 hours from the time we went into the OR to the time we got out. What did you think, my friend?
It was phenomenal. I thought it's going to be a lot of pain, but absolutely I felt nothing. It was very comfortable, and the staff were fantastic. Best staff I have ever seen.
Thank you very much. I appreciate that. So you didn't have any pain in the procedure. It was simple. It was nothing that you were very apprehensive before.
Absolutely not.
So we ended up doing a 56 square centimeter case, which is almost about 2 of our MaxHarvest procedures. Our one MaxHarvest would yield approximately 30 square centimeters. He had terrific elasticity, and his head circumference was a little bit more larger than average, which allowed us to get a lot more hair for the patient. So let's show you what we did. We were able to go through and recreate the entire frontal hairline the entire way around. Just gently tuck your chin down a little bit. We were able to build all the way through the vertex, and I'm going to spin you around here, and we were able to get all the way into the crown. So tilt your head back a little bit for me, kind of this way, just gently back like that. Yep, excellent. And then you jump. All right, here we are with Amir. Amir is back for a suture removal after a MaxHarvest Plus hair transplant procedure. We moved almost about 60 square centimeters of hair 12 days ago. How was the process, my friend?
It's fantastic. I feel great.
And everyone's going to be waiting for the results.
Thank you.
All right, congratulations, man.
Thank you. Thank you.
Look who's back. It's Amir. We are at 5 weeks from the day of the procedure, and he just stopped by to say hello and let us check everything out. So what's been changing for you?
Everything, I lost the crust, right?
Yeah.
And the hair is growing, and I just wanted to make sure like everything's okay and we're up to schedule.
Perfect. And are you seeing any hairs coming yet? Or
when I touch it, I feel, some little hairs, but I see a little hair, yeah.
Okay. Usually at the month point, we don't see much of anything. There are a few percentage of patients that do
grow right from the start, but that's pretty rare. Usually the average growth starts at about the 3 to 4 month period. But you have healed terrific. It looks like all the healing is taking place. You're seeing a little bit of redness. That's not unusual at all for 5 weeks out. Many of our patients will ask us, what do I look a month, 2 months later? Well, here's what you look like. We shaved Amir's head. He's already had his regular hair grown back. The suture line, you can see right now at this point, is pretty much undetectable, but let's take a look at it up close. So he's feeling great. So you can see the suture line through here, nice and healed. Pretty much, and this is going to continue to heal for the next, year, literally. So you can't even see it right now at the 5 week point. Imagine what that's going to look like when it's fully healed. So you can check it out all the way around. And while I have his head back, let me just tilt you back a little bit. So you can see everything's nice and healed. There's no weird redness or irritation or anything really cooking. I'm going to just drop you down again and just show the rest of the suture line. So that's the suture line. And the little hairs will come out of that as well. And as you can see, looks great. Okay? So it looks perfect.
Come on in. Hey, look who it is. Amir, nice to see you, man.
No
Thanks for coming
in. How are you, man? Holy smokes! It works!
Yes, it does.
Wow! Congratulations!
Thank you.
How do you like it? Man, wow.
Yes.
You love it? What do you think?
I love it.
How has it changed your life?
I've changed my life completely. Very happy man.
And you lost some weight too.
I have lost weight.
You're a whole new person.
New person.
Let's check it out. So were the videos true?
Absolutely. 100%.
So you got what the video showed. You said, hey, I want that, and you got it.
I did. I'm very happy. I mean, I could not ask for more.
Oh man, I get so excited. I mean, look at what a difference a year makes.
Absolutely.
Yeah, I mean the whole transformation with the weight. You look like a Hollywood movie star now, man. Holy smokes!
I appreciate it.
What are your family and friends saying?
Everybody's excited. They can't believe it, and they're happy for me. They're very happy.
That's so unbelievable. And you're doing Propecia?
I'm doing Propecia and Rogaine religiously.
So both Propecia and Rogaine.
Yes.
Awesome. Very important. Stay on those.
Absolutely.
Don't go off that.
No.
Because we want to make sure to keep what you have in place.
Absolutely.
So we don't go backwards.
Absolutely.
Just run a comb right through here. Everyone always is asking, is that real? Look at that. Look at this. Okay, so just kind of look straight up. So when we do that MaxHarvest Plus procedure, we want to reframe the entire way around. So all of this has been recreated with tiny little one-hair grafts, so it's super soft and natural the entire way around. So this way, when you look at him from a profile, you can see how it's reframed. He doesn't have that high recession. You can kind of look at both sides here. Again, so nice and reframed. Now this is one pass, keep in mind. So if he does another procedure, we would just fill that in and finish him off. Now I'm going to have you kind of show the crown, so tilt back a little bit. Look at that. Look at that. Holy smokes, man.
Yeah,
that was wild. All right, let me show the suture line. Wow. Okay, so suture line. Everyone wants to see what's going on. This is my first time looking at the suture line. Same time as the camera's looking. He just walked in the door. So what we're looking at is, there it is. Can you see that line right there? I've got a little pointer for you. So this line right here, that's the suture line. Okay, let's take it all the way across here. See that? Look at that. Right there. So my comb's going right over it. That's the suture line. Wow. Wow, man. Perfect. I just want to congratulate you again.
Thank you so much. Thank you.
And thank you so much for coming back in. I've gotten so many requests from my patients. I'm not even kidding. When's Amir coming back in? When's Amir coming back in? We want to see the follow-up.
Yeah.
And for you to come back in and follow through on that means the world to us. And I'm so happy that you look so amazing and it's changed your life for the better.
Thank you. It was a year ago on the August 17th, so I'm like 10 days or 12 days before
Awesome, man.
I actually had the procedure last year, so
Congratulations.
thank
man.
you so much, Dr.
You're
Bolton.
welcome.
I owe you so much. I don't know what to say.
Your
I'm so
happiness,
thankful.
your happiness, and you showing up is your payment, man.
Thank
I'm
you.
so happy
Thank
for
you.
you.
Thank you. Thank
Awesome.
you. I appreciate
Congratulations.
it.